something that confuses many people: skincare ingredient lists. Learning to read and understand product labels empowers you to make informed choices about what you put on your skin. Looking at an ingredient list can feel overwhelming. There are long chemical names, unfamiliar terms, and dozens of ingredients in a single product. But with some basic knowledge, you can decode these lists and understand what you're actually applying to your skin. Let's start with how ingredient lists are structured, because this gives you immediate valuable information. In most countries, including the United States, ingredients must be listed in descending order by concentration. The first ingredient is present in the highest amount, the second ingredient is second most abundant, and so on. This continues until you reach concentrations below 1%, at which point ingredients can be listed in any order. This means the first 5 to 7 ingredients typically make up the bulk of the product's formula. These are the ingredients that will have the most impact on how the product performs and how your skin responds to it. Let's look at a hypothetical ingredient list: water, glycerin, cetyaryl alcohol, niacinamide, hyaluronic acid, ceramides, preservatives, fragrance. Water is the first ingredient, meaning this is primarily a water-based product. Water is an extremely common base for skincare products. It's inexpensive, a good solvent for many ingredients, and helps products spread easily. Glycerin is second, which tells you this is a hydrating product. Glycerin is a humectant that attracts moisture to your skin. Cetyaryl alcohol is third. Despite the name alcohol, this is actually a fatty alcohol that acts as an emollient and thickener. It's moisturizing, not drying. Don't confuse fatty alcohols like cetyaryl alcohol with drying alcohols like denatured alcohol or SD alcohol. Niacinamide appearing fourth means it's present in a meaningful concentration. This product will likely provide niacinamide's benefits: calming inflammation, regulating oil, fading dark spots, and strengthening your barrier. You can see how reading even just the first few ingredients tells you a lot about what the product is and what it's designed to do. Now let's discuss categories of ingredients and what to look for. Humectants attract and hold water. These are crucial for hydration. Common humectants include glycerin, hyaluronic acid, sodium hyaluronate, aloe vera, honey, panthenol, provitamin B5, and propylene glycol. If you want a hydrating product, look for humectants high on the ingredient list. Emollients fill in the spaces between skin cells, creating smooth, soft skin and helping repair your barrier. Common emollients include ceramides, cholesterol, fatty acids, squalane, jojoba oil, shea butter, and various plant oils. If your skin is dry, rough, or sensitive, emollients should be prominent in your products. Occlusives create a protective layer on your skin surface that prevents water loss. Common occlusives include petrolatum, mineral oil, dimethicone, beeswax, and lanolin. Very dry skin benefits from products with occlusives, especially at night. They're the seal that locks in all the hydration and treatment ingredients beneath them. Antioxidants protect your skin from free radical damage caused by UV exposure, pollution, and normal metabolism. Common antioxidants include vitamin C, L-ascorbic acid, ascorbyl palmitate, magnesium ascorbyl-phosphate, vitamin E, tocopherol, niacinamide, vitamin B3, green tea extract, resveratrol, and coenzyme Q10. Look for antioxidants in daytime products, especially when your skin faces environmental stressors. Exfoliants help remove dead skin cells and improve texture. We have AHAs like glycolic acid and lactic acid, water-soluble surface exfoliants, BHAs like salicylic acid, oil-soluble, penetrates pores, and enzymes like papain and bromelain, gentle protein dissolvers. Exfoliants typically appear lower on ingredient lists because they're effective at low concentrations, usually between 0.5% and 10%. Retinoids increase cell turnover, boost collagen, and prevent clogged pores. You might see retinol, retinol palmitate, retinaldehyde, or if prescription, tretinoin. These are powerful ingredients that appear effective even at low concentrations. Peptides are chains of amino acids that signal your skin to perform certain functions, often related to collagen production. Look for matrixyl, copper peptides, palmitoyl pentapeptide, and various other peptides. The science on peptides is still evolving, but many people find them helpful for firmness and texture. Now let's talk about ingredients you might want to avoid or be cautious with. Fragrances can cause irritation and allergic reactions. Fragrance is one of the most common causes of contact dermatitis. If you have sensitive skin or are prone to reactions, fragrance-free products are safer. Note that fragrance or parfum on an ingredient list can represent dozens of different chemicals, and companies aren't required to disclose what specific compounds they're using. Natural fragrances from essential oils can also be irritating, despite being natural. Citrus oils, peppermint, eucalyptus, and many others can cause sensitivity. Natural doesn't automatically mean gentle. Drying alcohols like alcohol denat, SD alcohol, and isopropyl alcohol can strip your skin and cause irritation, especially in high concentrations or with prolonged use. However, small amounts in a formula might not be problematic, and they serve purposes like helping products dry quickly or penetrate better. Context and concentration matter. Sulfates like sodium lauryl sulfate, SLS, and sodium laureth sulfate, SLES, are cleansing agents that can be harsh and stripping, especially for dry or sensitive skin. Many people prefer gentler cleansing agents like cocamidopropylbutane or sodium cocoyl, isethionate. Parabens are preservatives that prevent bacterial and fungal growth in products. They've been controversial due to concerns about hormone disruption, though research hasn't definitively proven harm at the concentrations used in cosmetics. If you prefer to avoid them, many products now use alternative preservatives like phenoxyethanol or sodium benzoate. That said, preservatives themselves are important. Products containing water need preservatives to prevent dangerous bacterial and mold growth. Preservative-free products must be packaged carefully in airless pumps and used quickly after opening. Let's discuss concentration. An ingredient appearing on a label doesn't guarantee effectiveness. Concentration matters tremendously. For instance, if vitamin C appears near the end of a long ingredient list, it might be present only in trace amounts for marketing purposes. This is sometimes called fairy dusting, adding trendy ingredients in tiny amounts that won't actually provide benefits just so they can appear on the label. For key active ingredients, you want to see them high enough on the list to indicate meaningful concentrations. If you're buying a niacinamide product, niacinamide should appear within the first 7 ingredients or so, not tucked away at the end. Effective concentrations vary by ingredient. For example, niacinamide is effective at 2 to 5%, vitamin C at 10 to 20%, retinol at 0.25 to 1%, and hyaluronic acid at 0.1 to 2%. You often can't tell exact percentages from ingredient lists, but position gives you a hint. Let's talk about buzzwords and marketing claims because these can be misleading. Clean beauty has no legal definition. What one brand calls clean might differ entirely from another brand's definition. Clean doesn't automatically mean safer or more effective. Judge products by their actual ingredients and how they welcome to this compassionate space. Breathe slowly and deeply, centering yourself in calm. Today we're talking about hormonal acne and how to deal with it gently, a topic that affects many people and requires understanding, patience, and a multifaceted approach. Hormonal acne is acne driven primarily by hormonal fluctuations. It typically appears along the jawline, chin, and lower cheeks, though it can occur anywhere. It often flares in predictable patterns: before menstruation, during pregnancy, postpartum, during perimenopause, or when starting or stopping hormonal birth control. Understanding the hormonal connection helps you approach this type of acne with realistic expectations. Hormones, particularly androgens, increase sebum production and can cause inflammation in skin. When these hormones fluctuate, acne often follows. This is biological, not a failure of your skincare routine. Hormonal acne requires patience because topical treatments alone often aren't sufficient. You're addressing an internal trigger manifesting externally. Both internal and external approaches work best in combination. Let's start with topical care for hormonal acne. The basics remain essential: gentle cleansing, appropriate treatment, moisturization, and sun protection. Use a mild cleanser once daily in the evening. Avoid harsh stripping products that damage your barrier and make skin more reactive. For treatment, several ingredients help hormonal acne. Salicylic acid penetrates pores and reduces oil buildup. Use 0.52% concentration 3-4 times weekly. Benzoyl peroxide kills bacteria that worsen acne. Use 2.5% concentration as needed on breakout-prone areas. Retinoids are particularly effective for hormonal acne. They regulate cell turnover, unclog pores, and reduce inflammation. Over-the-counter adapalene or prescription tretinoin use 3-4 times weekly or as tolerated can significantly improve hormonal breakouts. Be patient. Retinoids take 3 to 6 months to show full effects. Niacinamide at 5% helps regulate oil, reduce inflammation, and support barrier function. It can be used twice daily and is gentle enough for sensitive skin. Azelaic acid has both antibacterial and anti-inflammatory properties. A product with 10 to 20% azelaic acid can help manage hormonal breakouts. Apply treatments consistently, but always follow with moisturizer. Hormonal acne doesn't mean you should skip hydration. Healthy barrier function supports clearer skin. Now let's discuss internal approaches. For many people with hormonal acne, topical treatments alone aren't enough because the trigger is internal. Hormonal birth control is one option for managing hormonal acne in women. Certain oral contraceptives that contain estrogen and progestin can regulate hormones and significantly reduce acne. This requires a prescription and discussion with a healthcare provider about whether it's appropriate for you. Benefits can include clearer skin, but there are potential side effects to consider. Spironolactone is an anti-androgen medication that blocks the effects of testosterone on skin, reducing oil production and acne. It's used off-label for hormonal acne in women and can be very effective. This requires a prescription and monitoring by a healthcare provider. It's not suitable for everyone. Pregnant women or those planning pregnancy cannot use it. For severe or cystic hormonal acne, a dermatologist might recommend isotretinoin. This powerful medication can permanently change how your skin produces oil. It requires careful monitoring due to significant side effects, but can be life-changing for severe cases. Supplements that some people find helpful include evening primrose oil, which may help regulate hormones, spearmint tea, which some studies suggest may reduce androgens, omega-3 fatty acids, which reduce inflammation, and DEM, diindolylmethane, which may support estrogen metabolism. Always consult a healthcare provider before starting supplements. Lifestyle factors significantly affect hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques regularly. Meditation, yoga, deep breathing, time in nature, creative expression. Sleep adequately and consistently. Sleep disruption affects hormones significantly, including those that influence skin. Exercise regularly, which helps balance hormones naturally. But cleanse promptly after sweating to prevent additional breakouts. Evaluate your diet. Some people find that dairy worsens hormonal acne due to hormones naturally present in milk. High glycemic foods may increase insulin and affect hormones. Consider eliminating these for a month to see if your skin improves. Eat foods that support hormonal balance. Cruciferous vegetables like broccoli and cauliflower support estrogen metabolism. Foods rich in zinc support skin health and hormone balance. Probiotic-rich foods support gut health, which affects hormones. Anti-inflammatory foods reduce overall inflammation. Stay hydrated to support all bodily functions, including hormone regulation. Track your cycle if you menstruate. Notice when breakouts typically occur. This helps you anticipate flares and adjust your skincare accordingly. You might use more targeted treatments during the week before your period when you know breakouts are likely. Be extra gentle with your skin during hormonal flare periods. Don't over-treat or use harsh products in frustration. Gentle consistency works better than aggressive intervention. Address underlying conditions if present. PCOS, polycystic ovary syndrome, often causes hormonal acne. If you have other symptoms, irregular periods, excess hair growth, weight gain, consult a healthcare provider about possible PCOS. Treating the underlying condition helps clear the acne. Thyroid disorders can also affect skin and hormone balance. If you have symptoms beyond acne, get your thyroid checked. Don't pick or squeeze hormonal breakouts, which are often deeper and more inflamed than other acne. Picking causes scarring and worsens inflammation. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Be patient with treatment. Hormonal acne takes time to improve. Topical treatments need 6 to 12 weeks to show results. Hormonal treatments like birth control or spironolactone can take 3 to 6 months to demonstrate full effects. This timeline is frustrating but normal. Don't expect your skin to be perfect every day of your cycle. Some fluctuation is natural and normal. You're aiming for overall improvement, not complete elimination of every breakout. Seek professional help when needed. If hormonal acne is severe, causing scarring, not responding to home care, or significantly affecting your quality of life, consult a dermatologist. They can prescribe stronger treatments and work with you to find an effective approach. Consider seeing an endocrinologist if you suspect significant hormonal imbalances beyond just acne. As we close, remember that hormonal acne is complex and often requires both internal and external approaches. Be patient with the process, gentle with your skin, and compassionate with yourself. This is a biological issue, not a personal failing. May your hormonal acne improve with time and proper care. May you find effective treatments. May you have patience for the healing journey. Thank you for this time together. Manage your hormonal acne gently and compassionately. Barrier repair or sensitive skin, as these often use physiological lipid ratios. Timing matters less for ceramides than for some other ingredients. You can use ceramide products morning and evening without concern about sun sensitivity or ingredient conflicts. Unlike acids or retinoids that require careful timing and introduction, ceramides are gentle and supportive at any time. This makes them easy to incorporate into existing routines without complicated adjustments. Ceramides work beautifully with other skincare ingredients. They actually help your skin tolerate stronger actives like retinoids and acids by maintaining barrier strength. If you're using potentially irritating treatments, applying ceramides before or after these treatments provides protective buffering. This doesn't reduce the efficacy of your actives, but it does reduce irritation, allowing you to use effective treatments more consistently. Niacinamide and ceramides are particularly synergistic. Niacinamide helps your skin produce more ceramides naturally, while also providing its own anti-inflammatory and barrier-supporting benefits. Using products that combine both ingredients or layering niacinamide serum under ceramide moisturizer gives you enhanced barrier support. This combination is effective for virtually all skin types and concerns. Hyaluronic acid complements ceramides by providing hydration, while ceramides prevent that hydration from escaping. Think of hyaluronic acid as filling your skin with water and ceramides as creating the walls that keep that water in. Using both together creates optimally hydrated, protected skin. Apply hyaluronic acid to damp skin, then follow with ceramide products to seal in moisture. Not all ceramide products are created equal. The type of ceramides used, their concentration, the formulation that delivers them, and the presence of supporting ingredients all affect effectiveness. Ceramides should ideally be in the top half of the ingredient list to ensure meaningful amounts. Products that use multiple ceramide types tend to be more effective than those with just one type. Formulations that include cholesterol and fatty acids alongside ceramides more closely replicate your skin's natural barrier structure. Some products use plant-derived ceramides, sometimes called phytoceramides, while others use synthetic or biomimetic ceramides. All can be effective, though synthetic ceramides that precisely mimic human skin ceramides may work most efficiently. The important factor is that the product contains effective concentrations of ceramides that can actually integrate into your skin barrier, not just sit on the surface. Texture and feel matter for compliance. The best ceramide product is one you'll actually use consistently. If a ceramide cream feels too heavy for your skin, try a lighter lotion, gel, or serum. If it feels too light and you need more richness, opt for a cream or balm. Ceramides can be formulated into virtually any texture, so experiment until you find one that feels good on your skin and fits your preferences. How quickly can you expect to see results from ceramides? Unlike dramatic actives that show visible changes quickly, ceramides work more quietly. Within days to a couple of weeks, you might notice your skin feels more comfortable, less tight, and less reactive. Over several weeks, dryness improves, sensitivity decreases, and your skin simply feels healthier. After months of consistent use, your skin's overall resilience improves, handling challenges like weather changes or new products with less drama. The benefits of ceramides are most apparent in what doesn't happen. Your skin doesn't react as much to irritants. Products that might have caused stinging feel fine. Weather changes don't trigger dryness or flaking. These preventive benefits are harder to measure than dramatic visible changes, but they're incredibly valuable for long-term skin health and comfort. Ceramides are suitable for all ages. Young skin benefits from ceramides by maintaining its naturally strong barrier. This is particularly important if you're using active ingredients or your skin is exposed to harsh conditions. Mature skin benefits from replenishing ceramides that decline naturally with age. There's no age too young or too old to benefit from ceramide-rich skincare. They're also suitable for all skin types without exception. Dry skin needs ceramides to restore barrier function and prevent water loss. Oily skin benefits from barrier support that allows normal sebum production. Sensitive skin requires ceramides to build protective barriers that reduce reactivity. Combination skin can use ceramides across the entire face or targeted to specific areas. Normal skin maintains its health with ceramide support. Think of ceramides as insurance for your skin. They won't necessarily create dramatic before and after photos, but they provide the foundation that allows everything else in your routine to work better. They're the unglamorous but essential ingredient that keeps your skin healthy, comfortable, and resilient. Investing in ceramide-rich products is investing in your skin's long-term health. Consider ceramides as particularly important during times of barrier stress. When you're starting strong actives like retinoids, increase your ceramide use. In harsh weather, winter cold or summer sun, boost barrier support with extra ceramides. After professional treatments like chemical peels or laser procedures, ceramides help skin heal faster. During illness or times of stress, when your skin is more vulnerable, ceramides provide protective support. For compromised skin conditions like eczema or severe dryness, ceramide products should be central to your routine, not optional additions. Many dermatologists consider ceramides essential for managing these conditions, recommending ceramide-heavy moisturizers as primary treatment alongside any prescription medications. The therapeutic benefits of ceramides for barrier-compromised skin are well documented and significant. As we close today's session, let's take 3 final calming breaths together. Breathe in, appreciating the invisible work ceramides do to protect your skin. Breathe out, releasing any neglect of your skin barrier. Breathe in, embracing the simplicity of barrier-supporting care. Breathe out, trusting in these fundamental building blocks. One last breath in, committing to ceramide-rich skincare. And breathe out, carrying forward this understanding of barrier health. Remember, ceramides might not be the most exciting ingredient, but they're among the most important. Every day that you support your skin barrier with ceramides is a day you're investing in your skin's long-term health, comfort, and resilience. Your barrier protects